Yeah. Good morning, all of you. And this is from Allur Pharmacy College. I'm Jay Balan, the principal of Allur Pharmacy College. I'm the moderator of this session by Dr. Dheeraj and Dr. Logendra Sharma and Dr. William Apudasundar on Omicron, the new variant of concern. And we are going to look into this issue in different angles and from different reviews of experts. So let us start with Dr. Lokendra Sharma sir. Sharma ji is a senior professor in the Department of Pharmacology, and he is in charge of this Pharmacovigilance Program Center of SMS Medical College, Jaipur. So we have Dr. Logendra Sharma sir. He is the initiative and he is the man behind this webinar. He has suggested me two speakers to have from USA. One is Dr. Dheeraj Kaul, who is the physician and internal medicine expert, microbiology expert. He's doing some research on the COVID diseases, and he is the man, the main speaker of the day. Also, we have microbiologist, biotechnologist on the part, Dr. William Arpurasunda. So we all can share some knowledge on this Omicron, the variant of concern about Indian and US perspective. So without taking much time, I would like to call upon Dr. Logendra Sharma sir to start with his words. Sir, please.
I'm Dr. Lukend, working in Pharmacology SMS Medical College as a coordinator pharmacovigilance center, and we also started medical device adverse event monitoring also. as uh, as everybody knows, this COVID first wave, second wave, Omicron or Delta variant, Delta plus. So basically, we are from beginning associated with this pandemic. We have started initially uh, as a emergency situations. At that time, there is very difficult situations. Everybody is have lots of fear about this disease. At that time, there lot of uh, problems related with deficiency of mass or deficiency of PPE kit. At that time, we are facing that. In second wave, there is a lot of difficulty of oxygen supply. Also, there is difficulty of ICU beds also. Now a new variant as variant of concern have lots of mutation is there, 32 mutations or 10 mutations in site of their attachment sites and spike protein mutations. So because of these mutations, everybody has fear that this Omicron, it can be a widespread or it can be a very infectious and may skip from RT-PCR testing. As far as this present situation is concerned, this Omicron, as Dr. William also brief about this microbiology part of this Omicron. But as far as the pharmacology point of view, new drugs, we know every aspect of pathogenesis of disease. We are able to treat, we are able to use certain drugs like corticosteroids and some antiviral drugs or some drugs which are we are already using, like ivermectin or these are the new drugs with anti-inflammatories. They have certain roles we identified for this treatment of COVID infections. An important role of steroid and oxygen, as everybody knows, it is well established treatment. So we have treatment with us, we have vaccine with us, and we have a large number of populations they are vaccinated. And along with recently we started the vaccine program for children also. That is a very important point of view. We have to start earliest for vaccination of children. Then we have to start booster dosing also. Recently, they have certain some countries, even India, has starting booster dose for healthcare workers also. In this situation, we have to sensitize from first wave, second waves, and we are trying to sensitize for uh, social distancing, for mask use of masks and sanitizations. This is continue in still. If suppose we are using or sensitizing people about this SMS, this is very important part. Another important aspect is we have large number of populations who have not received second dose, or they not received first dose also. So we have to sensitize population for vaccination also. We try to sensitize uh, populations for monitoring of vaccines, their adverse effect monitoring, and basically we try to remove fear of vaccination programs. So these are the basically different aspect where we are lagging behind in as far as the management of COVID. Uh, and another important aspect, try to remove phobia or fear of this disease also. We try to, because if suppose a person's having lots of phobia, a panic situation is occurs. In that panic situations, this mild patients of COVID, we are very difficult to manage mild cases, because of panic situations, mild patients may occupy ICU beds or oxygen beds, and without the requirement of their uh, oxygen, or this panic situations it created by the media or by special conditions, and it is very difficult to manage either Omicron or Delta Cron or Delta variant. Or there are so many variants is already uh, are not identified, or they may be coming in near futures. So we have to fight. We have to sensitize for vaccination. We have to sensitize for we have we have proper treatment for this. So uh, I think over to Dr. William Sundar here to give some or more important highlights about this Omicron, and hopefully Dr. Dheeraj Kaul is also join soon.
Yeah.
Thank you. Uh,
Thank you, sir. Thank you for your introductory talk. Actually, you have given a deep insight of this COVID diseases and the cases that occurred in Rajasthan and other details with respect to the treatment protocols and all. So it is very nice to hear from you, sir. Thank you.
yeah,
And now as Dr. Loendra Sharma was saying, we are moving towards Dr. William Arpuda Sundar. Dr. William Arpuda Sundar is traveling with me personally for the past almost 20 years. And from 2003, we are here, and 20 years almost. And he is a pharmaceutical biotechnologist. He is a man of research interest. And now we have Dr. William Arpuda Sundar. Can you please start with your introduction and introductory talk about this Omicron?
Thank you so much for your introduction and pleasant invite for this webinar, sir. Um, this the Omicron, as we all know that viruses usually tend to mutate very rapidly. And this Omicron is unlikely any other variant currently in circulation. This, the advent of Omicron is an ample evidence that we are not done with COVID, and the COVID is not done with us yet. So to look forward and to understand where this virus is heading, so we need to know and understand the origin of this Omicron. So one thing we can be relatively certain of is where this variant came from and where we can expect more variants to come from. So this variant carries around 60 mutations compared to the original Wuhan strain. And out of the 60, 50 are non-synonymous, 80 are synonymous, and 2 are non-coding mutations. Like there are three theories which explain the origin of this virus. Like one is said to be emerged from an immunocompromised patient, and the next probable theory is that it emerged from reverse zoonosis. So what is this reverse zoonosis? Like a human strain was transmitted to an animal, followed by the animal to human transmission, or that emerged from a treatment of a COVID-19 patient with a mutagenic drug, molnupiravir. So these are the three hypotheses which has been proposed for the spread of or for this origin of this Omicron. Let's see one by one. So first, talking about an immunocompromised patient. So we started encountering this COVID-19 from the December 2019, and we started giving treatment to patients by using antiviral drugs as well as antibodies. So a few patients started, a few immunocompromised patients were not able to respond to these treatments effectively. So in the face of our best weaponry of the time, the virus not only prevailed, but it became stronger. So it started learning how to evade our immune defenses. So what has happened is the variations that have evolved and emerged from these patients had a lot of mutations, not just the spike protein, but throughout the entire genome. So researchers have found that in one patient, in certain patients, there is a H6970 deletion in the N-terminal domain of the spike protein. So in a few patients, it was shown to have like E484K spike mutation. And in few more patients, it was shown to have mutations in the entire viral genome, including a wealth of mutations in the spike N-terminal domain and in other proteins, including the ORF1 and the N-terminal regions. So it was found that this Omicron carries some mutations identical and similar to those found in these patients. So Omicron could convincingly be the latest in the long list of such variants. So we can expect some more variants to come. That's what the researchers are telling. So on the outset, I'd like to welcome Dr. Dheeraj Kaul here, sir. Sir, Jay Bolan, sir, can you have?
Yeah. Good morning, and good evening, Dr. Dheeraj Kaul, and welcome to you. Welcome to this morning session by Allure Pharmacy College, and with the help of Dr. Logendra Sharma, we were able to reach you, and thank God. So we are talking to you by this time. So Dr. Dheeraj, without taking much of the time, we have already started, and one introduction has been given by Dr. Logendra Sharma, and Dr. William also has started his introduction. Can we have some words from you as your introductory talk so that we can know from you and we can move on to the further part of this day? Please, welcome, sir, and please, over to you.
Good morning to all friends in India. My name is Dr. Dheeraj Kaul. I am a internal medicine specialist with a super specialization as per Indian terminology in nephrology, geriatrics, and pain management. I'm involved in the COVID data research as well, and I do medical journalism on health topics. Currently, mostly my area of expertise now is in COVID data, and I do biotech analysis as well. So I'm involved in teaching for many years, medical students, nurse practitioners, PAs, different dialysis technician courses, and extensively involved in teaching education as well as career counseling opportunities in healthcare sector in US and Canada. So that's my very brief introduction. And thank you so much for inviting me and organizing a panel, educational panel like this. I'm very happy to be surrounded by such intellect people as you guys. And once again, thank you so much. And I'm sorry, actually, congratulations to all of you, because yesterday PM Modi ji did a groundbreaking move, something we were requesting for months on different media channels along with my other colleagues, on giving boosters to elderly, vulnerable and healthcare professionals. Since the month of March, we've been asking it, and finally it has come little bit, since the month of August, we've been asking it. Finally, it's come, and it's very good step, especially with the Omicron, thinking of Omicron, as all of us know, which I will talk a little more later on. So it's very welcoming step. And the second is between 12 and 18, we had very robust data on how vaccines can boost the immunity of kids, and adverse effects were almost nil. So scientifically speaking, it's backed. It's a very medically proven decision which they have taken. So all of you guys, I want to congratulate you. And because of that, there were back-to-back many interviews, and I just finished one in ABP. There will be one later on. I may have to step for 10-15 minutes out, and then I'll be rejoining. But I'm happy to start, and please guide me. Where should we start? I would really appreciate that. Thank you.
Yes, actually, we are come across two waves in India, and we are getting several news and through WhatsApp, through newspapers, through medical journals, and all media sources. We are getting information about Omicron, the variant of concern, and we are a little bit afraid about it. But we don't know clearly what happens and what is about Omicron and how far it is studied, and what are the sciences behind the changes happened in the Omicron that makes it different from the Delta Plus or earlier COVID-19. So these are all the things we wanted to learn. As the things are going little severe in US, you are in US and you are studying on that particular species. So I thought, we thought you can very well clarify these basic understandings about this disease, and we can be a little bit clear about it.
Sure,
So,
I think that's a very smart question you're asking. And the level we discuss and we talk in our seminars or researching data people, like data mining in healthcare, it's a little different level. So I'll not go into that depth of statistics in the benefit of the audience. I'll try to make it simple so that even a layman can understand, or a student of bachelor's of pharmacy or MBBS who's just at a bachelor's level can. Would that be okay if I come down to that level, or
yeah,
you would
yeah.
like me to be very, because I just want to gauge my audience. Okay, so
Yes.
basically, again, a lot of this would be something all of my panelists mostly know. See, first we have to understand there are few issues. I've been following COVID since January 2020. And just to give a brief history, our interest, and not only me, a lot of medical doctors in US, the interest grew because every year we see a wave of flu virus and H1N1. And every year we have to decide which strains are predominant. As you guys are in pharmacy, so you know what I'm talking about. So you have to tweak the vaccine every year. And how do we decide that? That's a very interesting way to look at it. We have to capture the initial viruses which are coming in and decide on statistical models which will be predominant. Are we always right? Absolutely not. It's a 50-50 shot. Flu vaccine in the best case scenario is 60% effective. Worst case scenario, 50% effective. It fluctuates between 55, 65, 50, 60, depending on people to people. So what does that mean? 2 people get vaccinated, 1 will be protected, basically. So that's where the emergency authorization use 50% came from, because we have given a full vaccine approval to flu because it's very longly tested, but emergency authorization approval for the new COVID viral vaccines was 50% efficacy. Why we are talking about efficacy? Because any vaccine or drug, when they are in trial, we use the word efficacy. When the trial is over, we call it effectiveness. So we will continue with efficacy because still we are receiving new data, and now the COVID is changed. So basically, in January 2020, we noticed the number of people who used to die every year from common cold or flu. There was a spike on them, and the spike was mostly seen in certain states like Seattle, New York, California, and that too in geriatric patient group. I'm a geriatrician as well. So people above 65 years of age is what we call geriatric. And these people, why were they detected? Because suddenly we started seeing in nursing homes, record number of people were requiring oxygen. And a lot of them ended up in hospital. They needed hospitalization. And some of them ended up in ICU and died. So it was a significant rise from 2019, 2018, 17. So we called it flu-like illness. Now, we were not even thinking there could be a very different virus which has jumped species. Okay, it acted like flu. It had little different signs and symptoms. In which way? The rate of progression to respiratory failure or respiratory distress in this virus, which was not named COVID till then, was very different than a flu. But none of us did genomic sequencing. Why? Because we did not know the genomics of it. Okay. So what happened is we just labeled it flu-like illness and moved on. Eventually, every 2 weeks, data is mined in US. We get the data reports, we look at them, and we see something doesn't make sense. So that's where the investigation starts. Eventually, when we looked into it, news started coming. I'm pretty sure you guys recognize what I'm talking about. In the month of November, December, January, every media, entire world, including Indian media, was criticizing China, how they are treating their citizens. They are pulling them out of the house. They are being inhumane to them. They are putting them in some quarantine centers. There is some kind of flu illness, viral illness. And eventually, in December, COVID was an open name, but not everybody knew about it. Not everybody. And matter of fact, if you dig deep, the cases we were calling flu-like illness started from November in US. And in China, it started from September. Now the data is very clear. They sat down on that information for approximately 6 weeks as per WHO, not as per China, as per WHO. And they raised the alarm. When the alarm was raised, WHO was supposed to notify. So they started calling it an epidemic of fast proportions. And that epidemic eventually was called pandemic in March 2020. A delay of 4 months, I would say 3 months, costed us a lot of lives. Why that happened? It's a very different debate. I will not like to get into it. It's a geopolitical issue and other things. But yes, there was a delay. There was a delay. I think somebody's mic is open. There was a delay in calling this as a pandemic. Why? Because that information was not shared with the governments, which could prepare themselves and do micro lockdowns and restrict travel. So the travel was unproportionally being happening. Matter of fact, all of you guys remember in February, there was a big event in Gujarat, Namaste Bharat. At that time, also the alarm of COVID was not very high. In the month of March, when I was looking at things, it really got me concerned, and I tried to reach media in India. I still remember the focus in March 2020, it's very clear to me, was on a gentleman switching parties from BJP, from Congress to BJP, Madhav Rao Scindia's son, I can't remember his name. So that was the focus of media, and there were mass rallies happening. So what happens? After that, you saw the first surge. Now, coming back to the science of COVID, you see the genomic sequencing was shared by China to US in the month of February to March, depending on which journal you look at. Once we had the genomic sequencing, we started identifying this virus. And this virus, we started tracking it back. We started taking the nucleic material samples and identifying COVID deaths in the month of January, February, even December, late December in US. So that's how COVID came out. Now, the theory which China gave is that it jumped species. Now, all of us know 70% of viruses which humans get infected with, if we have 100 viruses which can infect humans and cause disease, 70% of those viruses have jumped species from animal. They don't belong for us. Okay. When that jump happens, it causes havoc in our immune system. People whose immune system is robust and strong hopefully can deal with it without any long-term severe complications. Notice the words I'm using, without any long-term severe complications. Can you have an acute kidney injury without rise of a creatinine? The answer is absolutely yes. Why is it not picked up on creatinine? Because your rest of the kidney can compensate, your rest of the nephrons can compensate. If you have two kidneys and they're working 100%, if I cut off one kidney, your creatinine will be normal. Okay. So the reserve get damaged, and that has happened to a lot of people during COVID. So the point I'm trying to make is long-term complications, if they are mild, people don't even realize it. Eventually what will happen is you will have a small AKI and then your creatinine bumps. And why is it bumping and staying there? Because your reserves were long ago gone. With aging, we lose every year, we lose 1% of GFR, but that's a different conversation. What I was trying to tell you is COVID is not as benign as people think. Not acute. I'm talking about once you recover, you can have something called long COVID. A lot of debate is going on that. That's a separate topic. Now, eventually, when we had genomic sequencing of the COVID, we started identifying is better. If you recall, in the month of March, April, May, June, a lot of tests were developed, including the RT-PCR, to pick it up accurately. There were antigen tests, there was antibody test, IgG test, IgM test, but the gold standard was RT-PCR. Okay, so we have developed those tests. Now, 70% of viruses, like I said, have jumped species in humans, and they can cause severe diseases. So now, why is it a big deal? Because every time a new invader is being exposed to our immune system, which is naive to it, it really can take over the entire immune system. Either it can take over your cells, use the nucleic material, multiply, release millions of copies, and cause diseases, or it can put your immune system in a hyperdrive, and the immune system can start destroying your own body, which we used to call hyperimmune syndrome, which we saw in COVID because of what a lot of mortality happened. Initially, in the trajectory, there were many journals, including I myself, had proposed the role of steroid, and it was laughed at in the month of March and April. And now you are looking at it, it's a standard treatment. Matter of fact, if you get severely sick, steroid actually works. There is only few medications which work. Now, with the COVID, as it started growing, you started noticing the trajectory. So we had many variants, alpha, beta, and delta. And as the COVID is spreading, it's using the waves. Now, why is waves important? As you know, in the first 1918 Spanish flu, there were 4 big waves, and those waves were separated by months. If the first wave was 100%, the second wave was 500%, the third wave was 250%, the fourth wave was 100%, and the fifth and the sixth waves were smaller. But a lot of people don't realize it. The Spanish flu actually came from Arkansas in US. It happened during World War I. They took it there, and then a lot of returning Indian soldiers who were working for the British Army, they came, and 10% of Indian population, approximately 2 crore to 2.5 crore people, were wiped out of the planet because it was that deadly. Now, with the COVID in 1918, with the Spanish flu, the commute between the regions was very, very, very limited. Very few people were transcontinentally flying. So the travel time was huge, and transmissibility was limited because of the travel time. But with this current era, you can fly, you can be here today and tomorrow in New York, today here, day after tomorrow, or tomorrow in Sydney or Japan, wherever you want to be. So the virus travels very, very fast. Like Omicron has been in India for weeks. It's not a news to me. The moment we detected Omicron, it was everywhere. It's because we were not looking for it. We were really not looking for it. So we did not know it. It's in every country. So now coming back to it. So now you have many variants, many waves. We saw what happened in the first wave. That virus, alpha variant, or the even the earlier virus was causing less mortality. In first wave, you saw people were getting sick. Unless you have weak immune system, your geriatric patient group, most likely you will be just fine. In the second wave, we saw what happened in India, but in US, we had many waves. In India, in the second wave, you saw Delta. Delta came in. At that time, unfortunately, we had a lot of public gatherings in the month of March, and I was talking about how it can be so dangerous. We were saying if the virus will circulate, eventually you will have a mutant of a British variant which was circulating. And that's exactly what happened. Unfortunately, the rallies were not stopped. And then you saw in front of Delhi, there were so many protests. And this virus mutated. Now, with the Omicron, what is happening, and so many death and dying happened because the system crashed. Every country, the system was crashing, including in US. In the first wave, we didn't have body bags. We had people, we didn't have even people be able to use, the contact isolation gowns. People were using garbage bags in US, in a country which is full of surplus. Now, in the second wave, you saw basic things like oxygen. If you compare, same issues happened in US, any country, same issues happened in India. People were taken by surprise. And now, if I jump further to Omicron, why is Omicron of a concern? What is so special about Omicron? Because you're right, there were many variants between Delta and Omicron also. But why did WHO called Omicron the variant of concern in a matter of 3 weeks? That has unheard of. 9th of November, first cases were found in South Africa. And by 22nd of November, it was declared variant of concern by WHO. And the reason is, so far, we have not seen a single COVID variant which is so infectious. Number one, it is the most infectious variant out there, 6 times more than Delta. Not even first one. Now we are talking about Delta. Secondly, the number of changes it has seen in its entire structure is a lot. A lot of changes have happened. Now, why is that important? Because if you are giving a dead viral vaccine like Covaxin, it will be also affected because every part of the virus is changing. If you start looking, and I don't want to go into that depth because that will become very technical. But if you go into different surfaces of virus, different protein, different receptors, you will see they are very different. Matter of fact, the speed at which the nucleic material multiplies is the fastest in Omicron. Again, I'm going in technicalities, but for layman's purpose, the replication speed. So if it enters your body and reaches your nucleic material and start making millions of copies, even that speed is, I would say, 70 to 80 times faster than Delta. So why is it important? Because in day 5, the number of viral copies you would have in Delta would be 70 times more in Omicron, 70 at least. Why is it important? Because the amount of virus you are shedding, if you are infected, will be 70 times more. That's why it is becoming more and more infectious. Now, the other thing is, on the spike protein, which we have used to make the vaccine, there are 32 big mutations. 32. And on the receptor binding domain, there are 11 to 12 mutations. And why is it important? Because on the receptor binding domain, on the spike protein, by the spike protein, most of the vaccines, Moderna, Pfizer, they are using the spike protein to identify the virus. They will figure out the virus, how does the virus look like based on the spike protein. Your immune system is sensitized using the spike protein. So your immune system, which is T cell and B cell, they get triggered when they look at the spike protein, especially the antibodies. Now, if you change the spike protein, we have never seen so many changes on the spike protein in any variant as we have seen in this virus. And we all know As virus multiplies, it will change itself. Some of the changes are for good reason, and some of the changes don't help the virus, and some changes help the virus survive the immunity which people have gained. And those positive changes for the virus are called natural selection. The natural selection variant of the virus will keep gaining those further mutations. And all of us know viruses change information, bacteria exchange information, fungus exchange information. So if a person is infected with Delta, now he gets Omicron on top of it. They will exchange information, okay? And they will learn how to escape the immune system. And this happens in people who have weak immune system. That's why protecting people with weaker immunity, older people, is so important in breaking the chain. People don't talk about it. It's very important in preventing further mutations and breaking the chain. Second thing, if you are fully vaccinated, and now the definition of fully vaccinated is changing in US. We don't call people fully vaccinated who have 2 shots. Matter of fact, we are rethinking, should we start calling fully vaccinated people who have booster as well, 3rd shot. Many countries are giving 4th shot right now, including Israel and some of the Gulf countries. So the data on COVID is so exponential, it will take days for me to even talk about laser focused topics. So the point is, the speed at which a virus is evolving, we have to learn how to live with it. Otherwise, this virus will keep coming in waves and taking away our loved ones who cannot fight this virus. Like waves, like like a farmer cuts his crops every 6 months. New crops come and cut. The problem is, a human doesn't become age 18 or 22 in 1 year, but the virus can really evade your immunity in months. We have seen it. So that's why when you give a booster in 6 months, it boosts your immunity. What kind of immunity it will boost? It will help your antibody titers to grow up. How much percent? 22%. So if you talk about vaccine efficacy, which we can talk later on, I would like somebody to ask me another question, because otherwise, I can talk on these topics for days. So I hope I'm making some sense and people are able to understand what I'm talking about. Can you hear me?
Yes, sir. Yeah, we are hearing you, sir. Actually, it is a very deep insight on this emergence of viral disease called COVID, and how Alpha, Delta plus, and now Omicron has emerged in this world. And you have given a global scenario. You have highlighted on every important topic, on every important stage of this COVID emergence. So this is a very deep insight. I really appreciate your coverage that you have made on this topic from first to till date, day 1 to till date. That what I mean. So this is a very good thing to hear from you, and we are all almost all the audience are pharmacy graduates, and we are very happy to learn from you. Now we have among us Dr. Lokendra Sharma sir, who was the man behind. He's the coordinator of this pharmacovigilance program of India, who was in the place of deciding the protocols for the treatments, and who was getting informations about the protocols, different protocols that have been followed in this SMS Medical College. So we want to hear from Dr. Lokendra Sharma sir also some knowledge from this aspect, and then we'll discuss to you with some other questions.
I have
Over to
already,
you, Dr. Lokendra Sharma. Who was
thank you,
yeah.
organizers,
Yes,
and Dr. Dheeraj. You are giving some time for us. And I want to ask some important aspects also. What latest situation in US, and what about this new Delmicron virus is also emerging in different area. So I hope Dr. Dheeraj call is also highlight some important points of Delmicron also. Over to.
Def- Definitely. So, what Dr. Sharma is talking about are the offshoot viruses. There are 7 as of now, and I would talk about them actually little later, because currently our hands are full with dealing in Omicron and spreading awareness on Omicron, because that is the white elephant in the room. Now, I'm sorry, I may have to leave for 15 minutes, then I'll rejoin. But before I leave, I just want to re-emphasize one thing. With the Omicron, what is happening? Few things which luckily we have time. So give me 5 minutes. I'll just reorient.
Okay.
So number one, it is causing 6 times more infectivity. Number two, the rate of replication is 70 times more. Number three, the speed at which it can evade your immunity is unprecedented. Number four, because it is spreading like a wildfire, the new offshoots which Dr. Sharma started right now mentioning is something which will start concerning people in medical practice in 6 weeks from now. But he's pointing out right now. Why is he pointing out right now? Because he has read some journals. So, first of all, thanks for sharing that information, and I would love to share that. See, Omicron didn't show up overnight, it was brewing. When these things brew, we know the offshoots, we are studying them. There are many offshoots, 7 offshoots, like I mentioned to you. One of them he mentioned, and three more are there. One is in UK, Australia, US. 2 of them are overlapping, depending which state you talk about. But we will talk about them. But the key point is, if you are vaccinated, right, this virus, although you will get infected, but the number of copies in your body will be much lower. So your chances to give it to somebody is way lower. Number one. So you're breaking the chain right there. I'm not saying if you're vaccinated, take off the mask and have a good time. No, you have to live with this virus. That's very important. Now, this platform, because this is pharmacy, so I would like to reinstate, and I have requested Government of India to make certain kind of laws which doesn't let anybody to go to any pharmacy and buy a drug he feels like, because antibiotic resistance is a real phenomenon. These medications are not candy or some chocolate anybody can buy. And I have seen this, people who are not even trained pharmacists are running a shop. It's a real issue. So I'm sure Dr. Sharma has noticed it. During the second wave, a lot of patients wrongly got the antibiotics. And I was on the national media in India talking about it all the time. Please do not give antibiotics, because if you give antibiotics for a viral illness, you are doing way more harm than good, unless you have signs of superimposed bacterial infection, which can happen because of denuding of the epithelium. We all know that. But till people have signs and symptoms of superimposed infection of bacteria, it can do more harm to the patient. And the reason is, I'm sorry, they're calling back to back. I may have to leave I'll be back in 15 minutes.
Okay, thank you, Dheeraj Kaul. Basically, very well explained by Dr. Dheeraj Kaul, and I want to highlight some or more aspects, important aspects regarding issues of recent surge in US and Europe COVID cases. That is some situations or some media and some health experts point outing this Delmicron also. So this is Omicron and Delmicron. So they are new variant, basically, we can say. This in India is reported 350 highly transmissive on Omicron variants. So there are lots of cases coming out in India also, this Omicron cases. And in cases of Omicron coronavirus, basically they are recent, they are out, they have either of Omicron or even in Delmicron have maybe the reason for a recent surge or recent rise in cases of US and Europe in last few days, basically. In basically different task force in India, in Maharashtra, and various part of countries, they are working, and they are uh, they are watching what situations can be arise by these new variants and Omicron or Delmicron, whatever it is. This is basically Delmicron is also a new variant, which are saying that is a twin spikes of Delta and Omicron. So some mixture of, we can say it is mixture of Delmicron and Omicron mixture. It is, as Dr. Dheeraj Kaul explained, it is very infectious, or uh, six time and it is communicable, and 70 times, and what is highly speedily it is spread in different part of different area, and it is highly contagious, Omicron. And it is an important aspect of it is diagnosed by the RT-PCR. Another important aspect is we are able to treatment. We are know very well know what is treatment we can do for that Omicron or Delmicron. And another important thing is either efficacy, may be some reduction in efficacy, but efficacy is still there, and vaccine efficacy is there still. Maybe up to 90%, it may be drop down to 80% or drop down to 70%, but still the efficacy of vaccine is there. Efficacy of vaccine regarding serious illness is still there. That is the reasons mortality cases, and they are very uh, less number because of vaccination programs. Because of in India, we have given lots of Covaxin, which is whole virus, dead virus vaccination program is India. Another important aspect in India is also there is a lot of infections already have occurred in second waves, and we get natural immunity for this infection. So this is all important aspects as far as, and recently government of India started booster dose also, and for vaccination program of children's also. That is also important as point of important thing. Another important thing is in our state we are regularly monitoring, daily monitoring oxygen position in all ICUs, and we also daily monitoring all states. They are regularly monitoring ICU beds position and developing their oxygen facilities and their different oxygenation plant, and basically they are also working on sensitization for focused vaccination programs. And this is close watch, regular monitoring, regular meetings, and media is also taking a good part in as far as this monitoring of this program is concerned. So I think this is all important aspect we have covered. Over to Dean sir.
Yeah, sir. Sir, this is the main point that we wanted to discuss from medical side. And in the genetics part, we'll have some information. What happened to that Delta Plus, and how the Omicron emerged from the series. And that for that we need Dr. William Arpudasundar to unmute and talk about what are the changes, genetic changes that happened in the Omicron, and how it is more the spreadability of the organism got improved. So please welcome Dr. William.
Yes, sir. Sir, just continue from where I left during my initial things. Like as sir mentioned, zoonotic transmission. Almost most animal viruses, 70% of animal viruses have been transmitted to humans, and this the Wuhan strain was also one of the things which got transmitted to humans through the birds. So we can see that there is a reverse zoonotic conditions which were also had a major role from transmitting the lesser concerned variant to a more concerned variant. And now we can see that most of the animal populations, just like humans, the viruses have evolved and adapted to the immune pressure so far surviving in each of the populations, and they are infecting and reinfecting these people. And once one major concern about this is the mutation in the spike protein of PN501K, which is currently present in the Omicron. One more thing about this is the molnupiravir induced mutation. So we all know that this Omicron, the first cases of Omicron was detected in South Africa, and in South Africa, where this Omicron was first detected, molnupiravir, a viral drug. The mechanism of this antiviral drug is they change the genetic sequence of virus. They cause mutation in the genetic the genetic code of the virus. And eventually what happens is the viruses loses the ability for replication, and eventually the viruses will be released into the environment. They become ineffective. They can't replicate, they become ineffective, and they will be eliminated from the human body. And this antiviral drug has been taken for clinical trial in South Africa. It was a Merck's clinical trial, which began in October 2020. So the clinical trial was made in such a way that the drug was given to patients at, as we all know now, as an optimal dose, as well as it was given in a lesser dose to check the efficacy of this drug at a smaller amount. But there is no foolproof evidence that this virus is evolved because of this drug. But what we can say now is, like, the drug-induced mutation was predominantly from cytosine to uridine and guanosine to adenosine. And if we look at the differences in this Omicron genome and the original Wuhan variant, this is the major variant, and in this cytosine to uridine mutations are more prevalent compared to the guanosine to adenosine. And the same has been observed in this molnupiravir-induced mutation in other coronaviruses as well. So this is one of the major concerns, and we can say that this is a human-induced one. As even though we can't be sure that molnupiravir is a major reason for this Omicron variant, but it is advisable that we stop using the drug further. And coming to the next question, like how this Omicron starts evading the immune system and how it has got a rapid rate of spreadability and a rapid rate of replication. The first major thing is the alteration in the amino acid sequences. There are at least 50 amino acid altering mutations and at least 10 mutations in the coding and non-coding regions of this Omicron variant. And in this, at least 36 mutations are found in the spike protein. And we all know that spike proteins are the one which comes and attaches to the hostile receptor and binds to the cells, enter into the cells and starts replicating. And we also have vaccines based on the structure of these spike proteins. Now, what has happened is there are at least 36 mutations which have happened in this spike proteins. So, which is a major modulator of infectivity and immune evasion. So, many of these mutations are shared with other major variants of concerns or of interest, and these have been previously shown to increase the infectivity and decrease the recognition by the vaccine administered, as well as they evade the monoclonal antibodies also. So other mutations are very unique in this variant, so all of which may contribute to the increased functionality of this virus. So like what to say, this has caused increased rate of viral replication, suggesting it is very high. And so what happens is this Omicron is outpacing many aerial variants in terms of new infections, like it has outpaced both the beta and the delta variants. As sir rightly pointed out, the rate at which, since it is easily bypassing our even the Pfizer vaccines, people who have got 2 doses of Pfizer vaccine and who have been previously infected with this COVID, this Omicron is somehow evading and people are getting infected. The only thing is, like, it's not that much as deadly as it was in case of the Delta variant. It's somewhat less deadlier compared to the variants as far as the data is what we have received so far.
Thank you, Dr. William. Actually, we are a little bit worried that we have already vaccinated more than 100 crore people, and 100 crore doses have been given in India. And we were vaccinated, the Indian people, with 2 major vaccines, the Covaxin and Covishield. And now in the Western countries, they are going for a booster dose of this Pfizer and Moderna vaccines and all those things. How do you see the efficacy or the effectiveness of these vaccines that were used in India? Will it be beneficial to the Indian population, or based on the mechanism, based on the method of preparation of these vaccines? Can you throw some light on these aspects, Dr. William?
Sure, sir. Like, as we all know that the vaccines have been developed based on the external structural proteins. We have components, epitopes from the viral components, which has been included in these vaccines. So the major area of concern, what we are talking about here is, like, the vaccinated people are at least 50% protected compared to the non-vaccinated people. So we have been already exposed to a variant of this virus. So at least those variations which we have been previously exposed will save us from this outbreak. But the major concern is the people who have been unvaccinated, who have not received the second dose of vaccine, and people in the geriatric age group. And our government has, I think they have already announced a third dose for the frontline healthcare workers. As that will be a major boost for the people. Like, if we are able to achieve a third dose with newer epitopes included into the vaccines, that can give a longer immunity, which is much required. One more major thing which we can take from Dr. Kaul's speak is that break the chain. As long as we are able to break the chain, wear masks, avoid social gathering, this virus is not going to go anywhere. It will keep on mutating. It will come stronger. Actually, we have to grow stronger in our immune system. Our immunity has to grow stronger to tackle the infectious agents. But the reverse is happening over here. The virus is gaining ground. It is becoming stronger and stronger, and it's coming back to us in unexpected and unexplored ways. So the chief thing lies within us: break the chain, wear mask, avoid social gathering as far as possible.
Yeah, that was the suggestion given by one Madhavi from Bangalore, I think. He was putting the message in chat box that please reinstate that wearing of mask and avoiding gatherings, social distancing. These are all very important steps to be taken by the people at this time to avoid getting infected. So in this way, so this is the way we have some 100% correct. Yeah, Dr. L.D. Patel has also reinstated it. Thank you, sir. Thanks for coming here. And we have some senior people also in this web meeting. Dr. Devendra Patak, sir, welcome. And Dr. B.L. Patel, sir, L.D. Patel, sir, sorry, and Manvi, sir. So they're all here. You may also please make your input, sir. And now I ask a question to Dr. Logendra Sharma, sir, that, sir, how do you see this, the therapies that are given in India efficacious for the previous wave? Actually, if we are getting more and more Omicron cases, definitely we should have some treatment protocol for the new patients. But what was the success of the previous wave treatment protocols?
Basically, as far as the treatment is concerned, we are already well understand what guideline or what algorithm we follow for the treatment. We already have gone through. We have treated lots of patients all over the India. Maybe some modification or some have preferred steroids, some may avoid steroids. But problem with COVID is either patients immunity is triggered, or some patients immunity is not triggered. So issue is that some patients immune reaction is very high in the higher side. In some patients, reaction is not started, and patients have comorbid conditions or diabetes or immunity is suppressed. In that conditions, the patient's COVID infections can be of serious type of COVID infections. So at present situations, we have well understand treatment. We have already treated lakhs and lakhs of patients. We already treated ICU patients also, lots of serious patient also. We have lots of oxygen facilities also. So I think panic situations as occurred in second wave, it is very difficult. uh, Panic situation may arise in near future or at that type of because we have every district, every hospital, they have developed oxygen generation plants. They have linked oxygen generation plant to ICU also. So ICU bed facilities also increase. That is very in higher numbers. So hopefully we have good treatment protocol. We are very well understand as far as the treatment is concerned. Some new drugs they also arises, but I think we already have uh, treatment standard treatment protocols, and we can treat as we have our experience in second wave and first wave.
Yes. Sir, one more question from the student's point of view, that this is very clear that the COVID virus is infecting the people through this ACE receptors. This ACE receptors also play a vital role in the control of the blood pressure of the human beings. And now, is there any case that came to your attention that is there any ACE2 blocker users, those patients who are using ACE2 blockers, have any difference of the COVID infections, or is the COVID infection changed any ACE2 blocker efficacy, vice versa, like that?
This is basically very good questions, very intelligent, a very good question asked by your student. So basically, as far as my experience, some ADRs are reported after COVID. Some patients become hypertensive. Number one thing. So there is some role of this receptor is there. Second, ADRs, some ADRs we reported, even patient is not received corticosteroids, even then the patients develop diabetes also in with COVID and after vaccination also. This type of reactions, this also type of adverse effect is also occurs with vaccination also. We have seen hypertensive cases for 1 or 2 months. We have one interesting case of vascularity also. I do not understand. I do not have big knowledge of what mechanism behind this. There may be some immune reaction, abnormal immune reaction occur. Severe vasculitis occurs and patient is unable to do their daily routine work. So there are some interesting cases, and some interesting cases also we have after vaccination or maybe COVID, they developed some kidney pathology or proteinuria occurs and nephrotic syndrome occurs. So there are some few interesting cases of this type also, and more some interesting cases I may not remember, but they are most of them they are because of abnormal immune reactions, and that can be of after vaccination or that can be of after COVID also. That we are receiving reports of adverse effect. You can say adverse effect or some pathology occurs after COVID or vaccination.
Yeah. So, as far as layman's concerned, we cannot differentiate greatly between infection and immunization. Actually, we are using vaccines. Those are also creating that same kind of reactions in the body, and they are producing that antibodies in the body. But only thing is the clinical parameters that are controlled in vaccination, whereas in infection it is uncontrolled. So in every way, after a vaccination or after an infection, a man will get some kind of damages in their systems. Like Dr. Kaul was saying, that is a very interesting point, that we are not looking into that in that aspect, that our reserves are damaged. Actually, one of the kidney is damaged, or 50% of the kidney is damaged. Our body will not show any serious symptom, but the damage is already done in one side. But we cannot understand. If we get the secondary disease, the effect is more, or the endpoint comes in very soon. Like we don't have much options for the treatment of that kind of patients, like kidney damage, or what you are saying, proteinuria, and all these things are diabetes after treatment, diabetes after immunization. So these are all the points to be looked seriously by the medical and pharmaceutical people. A lot of study is required on these areas, because we need to have these kind of informations. We are first to have vaccination for COVID, and after getting the COVID vaccination, what are the possible damages in the body and physiological changes that has occurred knowingly or unknowingly to the body in a healthy man's
But
system.
most
So-
of the cases, abnormal reactions, they occur. They are linked with COVID basically. And vaccination, as far as the vaccinate ADR events is concerned, but patients complaining either occur because of COVID. So vaccination, as far as the vaccination concerned, documentation is not there, but the documentation is post-vaccination, post-COVID complications. There are long list of post-COVID complications, but the documentation of vaccination adverse event, they are noted. They are most are the mild cases. So definitely we have to promote vaccination programs. We have to support vaccination programs. But some media reports regarding COVID complication is, we also watch, and we have to manage that complications of COVID also.
Yes, that is what I wanted to learn from you, that what will be the scenario even who is already vaccinated or who is already infected with some other variant of this COVID. What will be the effect of this Omicron over the people? Is there any serious effect? Because we are, due to enormous growth of this social media and all those things, we are getting a lot of informations, but we do not have any valid data. So this information always confuse people that this is very serious, this is very, actually the media keeps the thing like this is to be in highlight for some days, Omicron. So
As far as this
we are
today,
getting
as far as this present today's situation, as we analyze, such Omicron cases or and any other cases, this is a mild form of disease, creating mild form of disease. Lekin suppose this mild form of disease occurred in case of comorbid patients or elderly patients, immunocompromised patients, or in that conditions, that mild infection can be serious for that patient also. That is the reason. And there's certain pockets of non-immunizations patients, certain pocket of kidney disease, immunocompromised patients, certain pockets of non-vaccinated children's. So these pockets, if suppose this virus is spread in large number in a very short period, then the healthcare facilities can be affected adversely. So we have to watch carefully. We have to take care of focused, uh, we can say focused monitoring or focused vaccination, and we have to watchful, focused focused form in this either of vaccination program or this passive surge of cases. Or then we have to watchful for all these abnormal conditions we have to avoid abnormal conditions. We have to stop abnormal conditions.
Yeah. Some question from the audience that what is the fatality rate of this Omicron? They're asking. Actually, is there any data on this?
Yes, as far as this fatality is concerned, this Omicron is, I think it is in India is from few months, but it may be more than months, we can say. As far as this fatality is concerned, we are not seeing this mortality and fatality of this virus, but still, if suppose this is fatality occurs is in large number of cases of co-infection, comorbid patients, then definitely fatality will increase. If suppose in very short periods, immunocompromised patients, they are affected, then their case fatality rate may be increased. But as on this, as far as the South African experience is concerned, fatality is less. As far as the US and UK it is concerned, fatality is less. But maybe reason of some other variant or some co-delta variant is there also. Some that may be the reason of some fatalities. But still, this Omicron, I don't think we have seen fatality by Omicron.
Yeah.
Sir, can
I have one interesting question too. Yeah, William, I'm coming to you. Yeah, you please share your opinion. That,
Okay.
That I'll ask the question
Sir,
little later.
can I share the screen?
Yeah, you can share it.
Sir, is it visible, sir? Screen sharing.
Yeah.
Sir, we were talking about the mutation in the Omicron. We can see. So this is the amino acid mutation in Omicron, where you can see this virus has got all the mutations from the earlier variants, like the wastewater variant, which was isolated from the US, the Delta variant, the Gamma variant, the Beta variant, as well as the Alpha variant. Apart from that, it has picked up a few more mutations, almost 13 mutations. It has been picked apart from the existing mutations. So we were talking about the original Wuhan variant, but here we can see this Omicron has taken up all the mutations from the previous variants. So a person who has been previously infected by any of these variants, or in other words, a person who has taken up the vaccine, or he has been naturally infected by any of these variants and he has been recovered, the chances that he may get a much higher dose of infection or higher degree of infection will be definitely less, because his immune system has been already exposed to these many epitopes, which is still there in this Omicron variant. The rate of spreading may be more, the rate of replication may be more, but if we are exposed to any of these things, definitely the rate at which it may cause a disease to us will be less, because our immune systems is already been exposed to these many epitopes.
Yeah. Actually, being immunized or being already infected, we are exposed to some of these proteins, and these antibodies for these proteins will be available in our immune system. That is the fact. In another angle, I wanted to ask you that question, that in our laboratories, the virulent microorganisms are subcultured periodically to reduce the virulence. The infectious nature of the microorganisms are diminished due to periodic subculturing. That was the science. If we continuously subculture some microorganism, the virulence of the organism will be lesser. So this is spreading more and more. Will it not reduce the efficacy or the infectious nature of the virus? It is getting every time mutated, and in some new way, it is coming to the people and threatening the people for their lives. What happens in this?
Yes, sir.
The viral mutations.
In case of bacteria as well as viruses, even for the preparation of these vaccines, bacterial or viral vaccines, the WHO guidelines is that it should not be subcultured beyond a certain limit. Like it can be taken up to a maximum of 7 seed cultures. Because what happens is beyond that, when we are using the subcultured variant, definitely the immunogenicity will be lost, ultimately leading to the loss of virulence. And once the virulence or the immunogenicity is lost, it will not trigger the required antibody production response from our immune system. But here, what is happening is, it's not happening, the mutation is not happening for good. I can tell you an example here. Like what has happened is a variant. Just a second, sir. I'll just can give you the exact mutation what has happened. So what has happened is there was a mutation in a strain which has decreased the infectivity of the virus. But subsequently, the same mutation has happened in that particular strain, and which has caused an increased infectivity. It is because of the crossing over of the genetic material within species or interspecies. Crossing over of this genetic material has taken place, and where the rate of infectivity has come down, it has undergone a second mutation in the same gene, and the rate of infectivity has gone up compared to the original version. So what has to happen is the second mutation should not happen, so that eventually the organism, the virus, will lose its infectivity capacity. But here it has undergone the second mutation, and it has gone back to its higher virulent form. So most of the researchers, when the strain got exposed, were expecting for a herd immunity, as well as mutations comes, the rate of infectivity as well as the rate of death will come down. I can give an example of what happened with swine flu. Around 10-15 years back, there was a case of swine flu. People were, the rate of infection was more, and people were hospitalized, and the rate of death was in such a way that people were not returning back from hospital. But that strain, even before the drug Tamiflu could hit the market, the virus was no more. That was what we are expecting in the case of COVID also. But here, what to say, it has evaded all our expectations and all the sciences, and it is keep on mutating for the bad of the human society.
Yeah, the COVID is in the screen or in the scene after 2019, but it emerged a decade earlier. Actually, COVID in another form that is emerged already in the world, and it was infectious. Maybe at the time, the social media and other media was not taking so much care for this COVID. And even that, after that, sometime Middle East syndrome was also there, MERS, MERS, Middle East Respiratory Syndrome Virus. And after that, we have got this virus, COVID-19. This is the second CoV2, second virus of this series. So we'll be getting a drug, as you say, after all the COVID virus is eradicated. It is very good news for the people, but this is a theory. We cannot exactly say that when the drug is discovered for COVID, all the virus, COVID virus is eradicated. We cannot say that scientifically. And this is the perception. Actually, I have one more question. My personal interest actually. Based on your theory of the mutations that are covered in all the variants, the Omicron has almost all the proteins of all variants in its almost all type of mutations happen. So how will be this covaxin, being a dead virus vaccine, be effective against these COVID infections in all the mutants?
Sir, whether it is a live or dead vaccine, the epitopes are the same. So the rate at which the immunity is being given to means we gain the immunity. There will be slight changes. That's all, sir. And the good part about this Omicron is that it is sharing the amino acid sequences of the previous variants. So even if the people are exposed naturally or through vaccines, we can expect at least a 50%. It's my personal opinion. We can at least expect a 50% of protection if at all we have been infected with this Omicron.
Oh. One more question, a step ahead, has gone by Dr. L.D. Patel, sir. What is the possible way to stop the mutation of the virus? Is there any way? Professor L.D. Patel, sir, from Gujarat, a senior professor, is asking, is there any possible way to stop mutation in viruses?
Sir, I have asked as a gentleman, not as a professor. As a common man, I asked the question to William.
No, sir. Actually, Lord Rama came to the earth as a common man, even though he is an incarnation of Lord Vishnu, sir. So you may be a common man in this meeting, but you are Professor L.D. Patel. So
okay, thank you, sir.
That is, yeah, sir. Is there any?
Sir, there was an article by Dr. Gavin et al. So he has devised methods to understand interactions of multiple genes and how they can contribute to the inherited viral trait in many species. And an observed trait may be the result of interaction of changes in two or more genes simultaneously, which we call it as epistasis. And this is the major concern for this Omicron viruses. So what is happening is, like I previously mentioned, like when there is a mutation in one S protein, which will contribute to an immune evasion, but the same mutation has caused a decrease in the affinity. A mutation in the S protein, which has contributed to the immune evasion, and the same thing has contributed to the decreased affinity. So what has happened is the second mutation has happened in the same gene, which has made up for the deficit by increasing the affinity. So now we have a strain which has got both increased immune evasion and increased transmission. So it is theoretically possible of such variant of concern prior to the discovery of Omicron, highlighted by this epistatic changes. But to answer for the question, overcoming the mutation, I don't think it is possible, sir, because it is there in the genes to mutate to a new variant. So as we all know that the survival of the fittest, the virus needs to survive, so it will undergo certain sort of changes in order to for its longevity.
Sorry, can you hear me?
Yes, sir. Please.
Yes, sir. Yes, sir. Yeah, please.
Sorry, I had to leave earlier because national media, they were calling again and again for the latest development. Just finished and I rejoined. So apologies for had to leave for that. I'm now open. So I wanted to talk very briefly because this is pharmacy students. So my friends, you have to understand what happened in India last year, 2020, when broad spectrum antibiotics, augmentin, you name it, was given to Z-Pack, Augmentin, and metronidazole. They were given to left, right, and center to every single person who was having any COVID symptoms, regardless. So what does that do? Once you give it too much antibiotics, it kills the good flora in your colon, in the gut. And that good flora is very important for your immunity. It is extremely important for your immunity. It's very important for your bone health. It's very important for calcium absorption, vitamin D, vitamin K synthesis. There are so many things. And now science is showing if you have good gut flora, you are also to some degree prevented from colon cancer and irritable bowel syndrome and inflammatory bowel disease, which is ulcerative colitis and Crohn's disease. So there is a protective mechanism. So what do you do by giving too much antibiotics? You kill that flora, number one. Number two, what do? You actually make the bacteria learn how to evade the antibiotics, which we call antibiotic resistance. Antibiotic takes decades to develop. If you lose important antibiotics, what will happen? We won't have any tools left in our hand to deal with those microorganisms which can evade the effectiveness of antibiotics. Like, for example, methicillin doesn't work anymore. We have to use, for methicillin resistant Staph aureus, we have to use vancomycin. So on ESBL, so many bugs are there which have developed antibiotic resistance. So that is issue number one. Issue number two, you will also kill good bacteria, good flora, and immunity will go down. So this practice of using broad spectrum antibiotics for every single person like a candy is very bad. And I think government has to take rules so that only a certified licensed pharmacist can dispense the medication, and they should track record of each and every antibiotic which is being given and not to be given without doctor's prescription. I have spoken about it on many platforms, and I hope that happens. Just like opioids or sleeping pills in India are controlled, I think antibiotics and antivirals also should have a track record of who's getting it, why is he getting it, because these are important tools for human civilizations. We cannot let it go. Number two, the mistake, when you have COVID, mild COVID, please don't take steroid. Steroid can cause more harm than good if taken. Why? Because steroids will bring down your immune response to the virus, and your immune system is what will fight the virus. So who gets the steroids? People who go in overdrive. Let me rephrase myself. What protects you from COVID? Your COVID appropriate behavior, your mask. Which mask? N95. I don't have N95. Too bad. Try to get it. Gamcha, not gonna fly. Gamcha is not what you should wear and protect yourself. I'm sorry. You have to wear N95. People who don't have N95, double mask. And people who have nothing and they don't have any access to anything, fine. Put something on your face, Gamcha. You'll have a psychological protection, maybe 10, 20, 30%. But use that. Number two, what can protect you from getting really with an infection is vaccine. Because vaccine will not protect you from getting infection in your body. That will be protected by COVID appropriate behavior, hand washing, social distancing, so on and so forth. But what will protect you? If you have vaccine, your immune system will be able to recognize the virus, will already have antibodies made, provided your immune system is strong, provided somebody has not falsely prescribed antibiotics and killed his immune system, provided somebody has not wrongly prescribed you steroids and killed your immune system, brought down your immune system. So what is important? You have, if you are vaccinated, what will happen? Your antibodies, when the virus comes, will start attacking. Your T cells will start attacking. So that is defense number two. But don't forget, the most important defense is your own immune system. Most of the people who are exposed to COVID just do fine. They come out of it without any issue. Why? Because your immune system is very robust. In the medicine, we take an oath of Hippocrates. What is that? First, do no harm. So if you are giving wrongly antibiotics to people, you are harming them. If you are wrongly giving steroids to people, you are harming them. First, do no harm. All the pharmacy students, you are an inevitable part of this link. So learn this, raise your voice, say no to unnecessary antibiotics and steroids. They can have adverse effects. Now, What happens if you catch infection? Should you put mask? Absolutely. Why? Because that mask, surgical mask you're putting, actually is protecting other people more from getting infection from you than you getting infection from them. What will protect you more is N95. So if you put a surgical mask, it's actually protecting the other people from getting infected to you. So why is not everybody in the world wearing N95? Two reasons. First, it's not easy to wear. Number two, it's not easy to work 12 hours with it. Number three, lack of awareness. Number four, lack of supply. Number five, in poor countries, cost. Unfortunately, the entire medical community has done a horrible job in propagating N95 or making it easily wearable. That is a fact. Entire community in the world. But that is the best protection you can do. Number two, get vaccinated, 2 doses. And now with the booster, 3 doses. The West is rechanging the definition of fully vaccinated to triple dose. Country, Israel, is saying we will call fully vaccinated by 4 doses. They are giving 4th dose of vaccine now. Okay, so this is fact. Now, what happens if you get infected? What can you do? If you get infected, you have to take symptomatic, you have to support your immune system to fight it. What does that mean? Sleep well, eat healthy, locally grown seasonal fruits and vegetables. Don't panic because your cortisol will go up. It will reduce your immune system, stress hormones. Do pranayam, lung exercises, monitor your pulse ox. And if you start having high fevers, having difficulty breathing, reach out to your primary care doctor, have pulse ox at home, check your vitals. But at the same time, keep yourself well hydrated. Not for people with heart failure, but routine people should drink a lot of warm water, honey, lemon, or whatever you want to do. Paracetamol, it will bring down. Most of the people will just do fine. Now, if you are somebody who got exposed to the virus or have symptomatic disease, and it's been 5 to 7 days since you have this, and you are somebody with kidney failure, cirrhosis, cancer patient, immunodeficient, HIV, on chronic steroid, and you know that your outcome will be worse, there are 2 options for you. Option number 1, which is more expensive in India, antibody cocktail. Now, unfortunately, that antibody cocktail doesn't work very well on Omicron. That's a fact. Okay, its efficacy has gone down. Number 2, the best news which came out 2 days ago, people are not talking about it. The first pill which came out is called Paxlovid. It's a combination of 2 antiviral. One is a ritonavir. It's called Paxlovid, and the cost is $530 in US. It was 2 days ago approved by FDA for symptomatic COVID for high-risk individual. There are 2 antivirals. One is nirmatrelvir, which inhibits SARS-CoV-2 protein multiplication replication, and the other is ritonavir, which is given just to increase the concentration of nirmatrelvir so that it stays in the system longer. So what do you need to do? You have to take these pills twice daily, 2 tablets of nirmatrelvir and 1 of ritonavir, 3 tablets in the morning, 3 tablets in the evening, a combination for 5 days. Within 5 days of onset of symptoms, that's the crucial part. The good part is you don't have to get hospitalized to get IV antibody cocktail. You can take it at home. Okay. Now, what happens if you develop very severe sickness? Then steroids is what we prescribe. Not to mild people, not to asymptomatic people. Steroids should not be given. That's very, very important. And please stop giving antibiotics. Do not give antibiotics unnecessary unless somebody has superimposed infection. A lot of studies are out there which are against ivermectin, which we were using earlier here and in India was giving. They really don't work. So these are very, very, very important things, especially for people belonging to pharmacology. See, medicine can be a lifesaver, but it can be a poison as well if given to the wrong person in wrong concentration. And I think any people for pharmacy understand this way more than anybody else. So I wanted to add that point. And I think one of the professors, he left before I could answer his question or I think he was talking about a new variant. Is he there? I think he's left. So I think he was talking about Delmicron, which is a variant, which is a combination of Delta and Omicron. That's what happens when you mix these viruses. And where does the mixing happen? In the weak body, in people who have low immunity. One virus comes, the other virus is there, exchange information, and a new strain is formed. That's how antibiotic resistance is also developed, by the way. So this is the same kind of trajectory, little different, but that is very concerning. It's still not outburst, but the cases are growing in Europe and US for Delmicron. And eventually you will be hearing more about it. And as all of us know, see, what did we see first? We saw alpha variant, which was from December 2020 all the way up to September. After that, we don't get any cases. Beta variant, which was again, if you talk about it, December 2020 and then September 21. And then we have Delta variant, which is the predominant variant right now, if you talk about the entire globe. And we have Epsilon variant, we have Gamma variant, we have Omicron now. So a lot of these variants, as you can see, have died away. Alpha, Beta, Epsilon, Gamma have gone. Now we are talking about Delta and Omicron is taking it over. So people have to take it seriously, because if a lot of patients come, any healthcare system can crash. Although the severity is not that much as of now, but the cases are 6 times more and they are growing like wildfire. Even if the severity is 50% of Delta, as per some of the reports, even half number of sick people come. But if the total number is huge, you will have a bigger problem in the hand. That's why WHO named it as the variant of concern within 3 weeks. It has never heard of. 9th November, first case, South Africa, 22nd November, variant of concern. So I hope I was able to answer some of the questions. If you have anybody has any other question, happy to answer. I can't hear you.
So nice of you, sir, joined again for the conclusion session. And I have given the permission to unmute all the people. If anybody wants to ask any question to Dr. Dheeraj Kaul, you may ask your questions. And it is open now session for 5 minutes. You may ask your questions and then we will go for concluding the session. Any questions? I'd like to hear from Dr. L.D. Patel sir also, who is the retired professor of pharmaceutics from Gujarat, LM College of Pharmacy, Ahmedabad. Sir, can you bless us with your words, please?
Yes, sir. Just a minute. Yes, nice
Yes.
talk by Dheeraj sir. Good points. Break the chain by William sir and by Lokendra sir also. They discussed the points in depth. We almost all participants are from pharmacy, but it is also good for common men. Sir, you said regarding the immunity part, own immunity, if we compare our Indian immunity with other countries, definitely we have, in India, we have pollution, we have impure water and everything. So peoples of India have more immunity than the others. And hence, I think, sir, this Omicron is not as much serious as the wave 2. That may be. This is my opinion. I need your suggestions and guidance, sir. Dheeraj, sir.
No, Dr. Patel, you are way more serious than me, but I would like to very, 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 very respectfully little bit disagree, because what the facts are showing, if I may share with you, one of the most common disease which causes immunocompromised state is diabetes. All of us know that.
Yes, sir.
You know what is the fastest growing disease in the entire planet?
Yes.
It is diabetes.
Yes.
Do you know the number one cause of mortality in West? It is coronary artery disease. And the number one risk factor is hypertension. but the fastest growing disease in the entire planet is diabetes. And guess which country is becoming the epicenter of diabetes pandemic?
Yes.
India.
Yes. Yeah.
Correct?
You are correct,
So
sir.
India, when you were young, and India now is way different. You guys, my own parents grew up eating organic food. Now in India, if you go, I traveled to Delhi. I was shocked to see there is a river called Hindon. For some people who have been to Delhi, they would recognize what I'm talking about. That is a dead river. No marine biology exists there. But on the shores of Hindon, they are growing vegetables, which is highly carcinogenic, and they are selling to common people. Now, if you eat that loki, ghia, or whatever vegetable, the cancer not gonna pop up in one day. It's gonna take decades. And good
Yes,
luck
sir.
trying to label it on Hindon vegetables. Same thing. I've heard a lot of pesticides are being used in West. Actually, it's a gift from the West. Pesticides, which we, this is a very. I talk a lot about health and nutrition, so this is a very different topic. But we as Indian feel very proud and we very nicely say Harit Kranti. But what you are seeing in thyroid and cancer rise in India, it's one of the fruits from the Harit Kranti. What was Harit Kranti? One good thing was genetically modified seed. The other was they killed the organic soil. They put so much pesticides, so much fertilizers. Try good luck de-cleansing that soil. That will take like so much. We actually in US, if you go, the amount of money you have to spend to decontaminate a soil of 1 hectare of land is more than the cost of the land. Did you understand what I just said?
Yes. Yes, sir.
It is
Yeah.
a very big problem in your hand. So
Yes.
what you have seen, what you have had, the dincharya you had is very different for the youth. The level of stress young people are dealing with in this competitive world is very different when you were 20, 30 years old. Stress kills your immunity. If you don't have good sleep patterns, it kills your immunity. If you are working in hedge fund, if you are working as an investment banker, if you are working as, I don't know, civil servant, maybe exception, but any higher position, your sleep is almost gone unless you are really 1% of the pool. And I think you guys all, everybody's more senior than me, and you can please correct me, but I'm seeing this pattern in US, I'm seeing this in India.
Yes.
Unfortunately, in India, there is no
Yeah.
regulatory body which makes
Yes.
sure a person will go to jail if it is selling carcinogenic vegetables to people, or he's selling the meat or chicken which is fed steroids and it becomes 5 kg more. A huge chickens. There is no punishment. There is no fear
System
of
in
law.
India. Yeah. No system
There is
in
no
India.
fear of law, no accountability. I mean, look at the rallies. You think this is the right time? So what I'm trying to tell you is it's very unfortunate. We gave the West the real knowledge, and most of it was burned in our libraries. I study, Professor Saab, I study ancient Vedic Indian medicine for my own interest. I don't
Yes.
want to share it, but my eyes are opened when I look into the ancient Vedas. I mean, I think people are listening to me, so I don't want to talk more about it. But theory of relativity was discussed when, if you talk about Jagannath Puri, if you know the story, that is straight up theory of relativity. A person travels to a planet, comes back, 3 decades have passed. Time is
Yes.
traveling very differently, is traveling faster than the speed of light, comes back, the world is changed. Straight up theory
Yes.
of relativity.
Okay.
And that
Thank
is
you.
thousands of years ago.
Thank you, sir. Thank you. Yes.
So my point to you is the beauty and the nature you guys have cherished doesn't exist anymore. 2035 is the year of no return. If we don't wake up, bring down our carbon emissions, this planet won't be the same. And that's why PM Modi, when he was here, I really applaud him for committing 2030 to decrease the emissions by 35 to 50% in India, which is a very big task. And I want to wish him good luck, and I hope everybody supports him. That is for the entire planet. He's doing like a real leader. So, I don't want to go against what Professor Patel is telling, but please don't assume that your immunity would be same like Professor Patel has grown up eating fresh vegetable, locally grown seasonal fruits and vegetable. Professor Patel, you tell me, when you were a small kid, were you able to eat tarboos in December? Probably never.
No, no, never.
Exactly.
Yes. Yes.
But now you can eat
It is
any
a-
fruit you want, but
Yes.
actually it does more harm than good.
Yes, sir. You are
Because
right,
there is
sir.
there is a cycle. There is a biological clock in your body. There is a biological clock in the nature. We are disrupting it. You
Yes.
see, I'm not supposed to live in North Pole. I'm meant to live in India, but I'm living here. So by default, my immunity is low. So your habitat, if you're living there, you have a better position. So I hope I answered that question.
Okay. Thank you. Thank you very much, sir.
Thank you, sir. Thank you. And one more question is, Kaveti Balaji has raised his hands. Can we hear the question from him?
Yeah,
Balaji?
thank you, sir. Yeah. Am I audible,
Sir.
Dr. Balaji?
Yes, sir. Yes, sir. Yes, sir.
This is my question to the Dr. Dheeraj. Sir, actually, I would like to know a little bit progress on the kind of variations that is bringing about now the Omicron. Any such kind of prediction work is going on, sir?
Can you rephrase the question? I'm sorry, I could not understand.
As we could notice that changes that is happening from the Delta Alpha to the Beta and Gamma and now the Omicron. So here any such kind of the work it is happening in the direction of prediction of the changes that is taking place.
So you're talking about detrimental changes to the virus or progressive changes for the virus? What changes?
The progressive changes, the mutations that are actually happening.
So the mutations which are helping the virus, is that what you're asking?
Yeah.
Yes.
Any such
So
kind
that
of
is where,
work
yes.
progressing on that
So
prediction.
I would highly encourage you to go to a couple of websites. One is CDC, one is WHO, and New England Journal of Medicine, and JAMA. And there is another journal called Nature. So if you are somebody who likes this kind of data, because I have to do this every single day, very, very good resources. Even Government of India Health Ministry has also a website which publishes COVID data, and it's kind of lagging between the international community and the Indian updated system. But the question you're raising is very important, because you see, the virus wants to live.
Yeah.
He needs bodies. So what is helping him? We are helping him. If you lock yourself in a room, take medicine, this virus is going to die. But we are very social people. We have such thing called COVID fatigue. We go outside. So the virus, you won't believe it, 1918 Spanish flu, there were 4 to 6 waves actually. First 3 waves I described in the beginning. The first wave was 100%, for example. Second was 500%. Third was 250%. Fourth around 200%. Fifth, sixth, 50%, 40%. But the virus stayed till 1954. Last cases were found in 1954. Okay. So what is going on with Omicron? There are many offshoots. See, variant of concern, I just named few of variants of concern. I'm happy to read them again. There was alpha, there was beta, there was delta, there was epsilon, gamma, and Omicron. Currently, you're just hearing delta and Omicron, right? Yes. Alpha, beta, and gamma are almost gone. Epsilon doesn't exist anymore. We don't hear about it. And the reason is what? The reason is these mutations are not able to help him evade the immunity of the new bodies. So there are only 7.8 billion bodies in the planet as of today, because people are dying, people are burning. This virus wants new hosts. The problem is it multiplies at a very fast speed and it uses your resources, then offshoots. So it is learning your immune system. It is knowing which kind of antibodies are attacking it, using that information, making new copies and spreading it. Eventually they will meet, different viruses will meet and change information. Just like in Delmicron, it is Delta plus Omicron. So the good mutations will help virus to survive. Good for the virus, bad for humanity. And that's what Omicron has done. The largest collection of spike protein changes is in Omicron. The largest collection of mutations which makes the virus very infectious is in Omicron. But there is a negative spin to it. The severity of illness is 50% of Delta, 40%, 50%. But again, the data is very premature. We should not make a conclusion. Even if it is 50% less severe, there will be people whose immune system is weak. You see, I give you vaccine, but if your immune system is weak, you're not going to have the enough antibody titers or T-cell immunity. Have you heard of doctors who were fully vaccinated died? Why? They had really bad diabetes. They had cancer. They were on steroids for arthritis, or you name it. Or some genius gave them excessive steroids for weeks, and you had mucormycosis in your hands. The worst in the planet was in India. Why? Because of the disruption, because the MBBS students who are practicing on ground, or nowadays there is such a thing called Ayurvedic, and I mean, I have respect for all of those, or homeopathic doctors. They don't, I don't know why, but they don't feel the need of being updated. You won't believe it. My interviews are watched by thousands of people, and like hundreds of people known to me reach out to me every single day asking me to send the link. So I tell them, go to Google or YouTube, maybe they will upload it. I mean, I don't have time to send to so many people. So the point I'm trying to say is the nature in India to keep yourself updated every single day with the new article which is coming doesn't exist. And I think there is something to do with greed. Sorry, I'm not trying to hurt anybody, but people are thinking, instead of reading journals for an hour or two a day, I rather see 10 more patients and make that $10,000, 20,000 rupees more. Maybe I'm wrong, but I have seen that happening in my friends. People running ICU have not read a journal for 6 months. That is unheard of. And I talk to them. So, I hope with future that pattern will change, because healthcare is the utmost responsible profession. This is a profession of giving. You are dealing with people's life. You have to be very, very, very updated. And you saw what happened. I was on national media talking for months not to give generic antibiotics, for months not to give steroids to everybody, but that happened. And 3 months later, mucormycosis was in your hand. So answering your question, Omicron, like I said, has gained, these are called gain mutations. If you do it in lab, it's called gain of function theory, which is a very different talk. I am happy to talk about that. That's a conspiracy theory. And this is not the place to talk about it, but that's very different about why did COVID come and what's the etiology and all those things, which countries were involved in geopolitics. So that gets very political. But having said that, you are right. It's a very important fact. And that's why the entire world community keeps an eye on things called variant of interest. And there is such a thing called non-variant of interest. And the highest stage of thing is variant of concern. But there are 5 more stages. And again, that will become very technical. If I start talking about that, a lot of things will go over people's head. But don't underestimate, there is so many people who are in data mining. We are keeping an eye on every single offshoot which is coming, looking at the genomics, looking at what can make it very concerning, what cannot. And every few weeks, the numbers are changing from variant of interest, the downgrading, or from variant of interest, if it is really concerning, variant of concern. Omicron was fastest variant of concern. From 9th of November till 22nd, it become first case is 9th of November, variant of concern in 3 weeks, 22nd of November, less than 3 weeks, 2 weeks, something. So why? Because once burnt, you twice check yourself. So WHO is now on its toes, rightly so. Again, it will become political, what was happening before. But the point is, WHO now is way more precautious and on top of the ball game.
Yeah, thank you, sir. Thank you for your highlights. Actually, this is very important point to note that healthcare people has to be updated at all the times. And one more question in the chat box also: why pharmacists should not make an antiviral tablet against the strains of virus to control? So these are all the things that has been already explained, I think,
okay,
by Dr. Dheeraj. He has given the approval of FDA in the past 2 days. We have come to know now that US has approved 1 pack of antiviral drugs.
So I just want to add one thing. I think I forgot to add. If you get Paxlovid, what will it do? So it's a magic pill, because within 5 days of symptom onset, if you take this treatment, which is basically 10 courses, as in morning, evening for 5 days, 2 of the antiviral and 1 of ritonavir, which is increasing the concentration of the drug. Paxlovid is the name, and $540 is the cost, which insurance will pay. That's the debate going on. Approval is for anybody above age 12 with kilogram, 40 kg of weight plus. Within 5 days, if you take it, what happens? 90% chance you would not need hospitalization, 90. So it's a magic pill because you can take it at home. What is something else which can prevent progression of disease? Antibody cocktail. But unfortunately, it's an IV. You have to go to the hospital, get it infused. And then when you come back, the efficacy is way lower of against Omicron than it was for Delta. So we have challenges. So antibody, you will see synthetic antibody cocktail, they have to revise it. Just like new generation vaccines gonna be coming.
Yeah, thank you, sir. And is there any question from any other audience to address by Dr. Dheeraj? Anybody else? You can please unmute yourself and talk. Otherwise, we will move on to the conclusion phase. Now I request Dr. Lokendra Sharma, who was the man instrumental in this webinar. Sir, please conclude from your side so that we can move on to the next stage.
Thank you, Dheeraj and Dr. Patel and all dignitaries and Bala sir. So thank you very much for giving us time, Dr. Dheeraj. Thank you very much. Thank you.
Yeah, we thank Dr. Dheeraj whole from our heart that he has given time. That is very important thing at most, and he has given energy and shared his knowledge. This is a great thing. Now we are talking in the morning, early morning. He is on Christmas Day evening, late night. He is sitting for us, and between his tight schedules of many international media and their activities, he is coming with us and he is talking to us. So thank you, sir, first of all. And please all of you unmute yourself, mute yourself, and once when you're willing to ask any question, you can raise your hand and ask. So this is the thing. Thank you, Dr. Dheeraj Kaul, and thank you, Dr. William Arpudasundar, for giving some presentations and some illustrations about the proteins of different strains of COVID viruses. Thank you. Thanks for your effort. And Dr. Deldi Patel, Dr. Manvi sir, Dr. Patak sir, so many leading process and elderly people have joined in the morning. And, to conclude this session, I'd like to share a small PowerPoint presentation that has been created by the Department of Pharmacy practice people at the beginning of the COVID to make awareness to the people as a small presentation. So please see this. This is the basic requirement that the pharmacy practice students have created. I'll share this for a while, and this will be concluded after this PowerPoint presentation. Sir, can I end up after this presentation? Dr. Dheeraj, is there anything to add?
Sorry, I just want to first of all thank everybody, Dr. Sharma, Dr. Patel. Dr. Sharma actually got me introduced here. I'm very happy. I'm involved in education here. So it's a very good platform that we were able to share. But, you know, I feel because I do some analytic work for Wall Street also, and I'm seeing, can you mute this? Yeah. So because I'm seeing, I would like to tell the students of pharmacy, future belongs to you guys. In healthcare, world is changing very, very fast. There is such a thing called genomics. Please read about it. Gene editing, it's a real phenomena. Okay. And then gene editing is a way I can switch on and switch off your gene, manipulate the genetic display of the genetic information, prevent many diseases from happening early on, and remote monitoring. And remote monitoring is is integrated with pharmaceutical delivery systems. So what I'm trying to tell you is regenerational medicine and genomics is an area which is going to boom. We are expecting the growth of 300% in next 1 decade. 300%. The type of medicine I have learned is very old dated. Gone are those days when you will be giving a pill for hypertension and people have to take it for rest of their lives. That's torture. It should end. And we have technology which is going to be existing in next few years. Gone are the days when your own cells cannot be regenerated. It's already happening in animal models. It is very progressively happening, which is called regenerational medicine. Please read about it. That is the horizon. That is the next thing in healthcare. You will see a drastic change in healthcare in next 10 to 15 years. So if you are understanding where the world is evolving, you will find yourself on the right side of the page. If you will keep following what, sorry for, I'm not trying to tell your students otherwise, but if you keep following those textbooks which were written 50 years ago, you will end up in the same state of mind. So currently, the world of healthcare is evolving with each minute. Every minute, at least 11 articles are getting published, every single minute in various journals. In big journals, every week, dozens of articles are coming in big journals, different across the world. So please try to keep yourself updated. And in the cancer treatment, targeted chemotherapy, targeted medicine delivery, these are future frontiers. And who will lead the role? People who don't have medicine, MD or MBBS. We need MD PhD combination in India, like we have it in US. That's what we need. MBBS should not exist anymore. I'm sorry. You cannot be a doctor with a bachelor's degree. Nobody will trust you. It's not enough time to learn about human. You have to have a 7-year MD program, maybe 8-year MD with PhD, so that they are clinical researchers. We need minds like that. Okay. And the second thing, what I would tell you is please keep yourself updated, read international material. Do not rely on an Indian journal which is reporting to you which things which were discovered 5 years ago. Okay. Be updated. You are the one responsible for your future. No government, no professor, no university is responsible. Okay. You're studying in AIMS and you don't know ABC of the latest development. I have taught students like that. And they think because they went to AIMS, the God should come down and give them a flower bouquet. World doesn't operate like that. When you come on the international platform, nobody cares you are from IIT, IIMS or AIMS. Prove your mettle. How will you prove your mettle if your information is 6 decades old? So please come to the power of the world. Smell the coffee, wake up. The world is changing at a very, very fast speed. And it is your responsibility as a student to keep yourself updated, not the teachers. That system, do not wait for that system to change. You cannot change the system. You can change yourself. And the world is going to be yours. I'm very confident that student of pharmacy who understands its concepts, basics from eminent professors like sitting here, but keeps it one eye in what is happening. Matter of fact, you should think when I graduate, what things will be coming, not what is happening today. But you won't be able to see that vision till you know what is coming every day. And for that, you have to take out time. You have to sacrifice. You have to put your full effort in your student ages so that you can be way ahead of everybody else. And that's what will get you respect. And on that note, I want to wish everybody very, very good luck. And I'm very happy I connected. In future, if you have a topic on education or healthcare related, let me know. I'll be happy to join. Thank you.
Yes. Yes, sir. We have ideas. Actually, we are in contact with Dr. Lokendra Sharma for past 1 year, and I was asking for the person like you to accomplish these topics like the medications and medication errors by pharmacists and physicians. So we are having several topics, especially in the chemotherapy. So I was asking Dr. Lokendra Sharma sir for a physician who can join with us.
Dheeraj is very expert in some skill training or very advanced technology, artificial intelligence and machine learning.
Actually,
and so we can plan for some pharmacovigilance, artificial learning, machine learning, or some or more advanced technology with Dr. Dheeraj Kaul, and we can organize some or some event with Dr. Dheeraj.
And I would encourage you to tell your students that they should prove themselves why world wants them. Start an article, start a research paper. I think that mindset of, boss, I'm going to get a degree and stand in the shop, it's a waste of energy. Anybody, any Any fifth grader can sell a medicine in the shop. You just need to read prescription and give it. A robot can do it. Sir, days are gone. In next 10 years, you will have a drug dispensing machine like the soda machine you have. You go, you put your money and Coke comes out, same way. You show your ID, it's gone and you will get. Then what? You lose your job and run Uber taxi? No. You need to see, system will take time to change. We're not here to do revolution.
We in our one project, we have established with collaboration of some US or WHO drug dispensing machine. We have established in some
Exactly.
health centers with,
Exactly.
with consultation with telemedicine persons.
Exactly. So what I'm trying to tell Dr. Sharma, the mindset of a student applying for bachelor's of pharmacy or master of pharmacy should not be, I'm going to stand in the job. Then boss, do some technical course, learn something for 6 months and don't waste our time. I want to, because your time is energy. You want to feed that energy and time and effort to the right kind of crop. And unfortunately, I'm very sorry to say, pharmacy for some reason is not getting paid well. That's why it's not attracting very big talent like medical schools do, which I totally disagree from. The salaries should not be very different in medicine, pharmacy, or whatever other para you in a right kind of world. But talent has to be attracted. And guess what, Dr. Sharma, who makes the most amount of money, who has a medical degree in America? People who work with a pharmaceutical company. Their salaries are $10 million, $15 million a year with bonuses. But to get to that level, you need to know your stuff, you need to be very active, and you need to get there. So if you have a pharmacy degree like PhD in pharma, and you come to US, do a bridge course, and then you join Merck, GlaxoSmith, or whatever company you want to join, sky is the limit for you. But a student entering bachelor's in pharmacy, I don't think he has that vision. Correct me if I'm wrong. So that vision has to be shown to them. You have to tell them, boss, the field you are picking up is gonna take you to the highest level ever you can. Any doctor nobody can compete against you. So I think that's the vision. That if I had to address an orientation, that's where I will take.
Yes, we will definitely have you in our future programs, and we are planning for some of this kind of programs to motivate the students in this aspect. And some of the teachers need to be addressed in these points. Actually, in faculty development programs also, we have to give this kind of motivation to the teachers so that they can very well guide their students to make this kind of attitude to build themselves. So this is very important thing. So thank you very much, Dr. Dheeraj, for your enthusiasm in growing the profession. Thank you. And I'll end up the session. It's already, we have taken much of your time in the late night. It is 11:21 here. I think it's 1:30, I think. There.
It's 12:51 midnight.
12:50 midnight. Thank you. Thank you very much, sir.
Thank you so much.
And
thank you.
By sharing one slideshow, I end up the program, and I'll be in touch with you, and I'll be getting you in some other development programs of faculties and students very soon. Thank you, sir. Thank you.
Thank you so much.
Thank you, Dr. Lohendra.
Thank you,
Dr.
Thank you, energetic Dheeraj, sir.
Thank you, sir.
Thank you. Thank you.
Thank you so much.
I share this slideshow and I end up the show. Thank you, sir. Thank you, all of you, for joining this meeting.
Thank you, sir.
Thank you, Dr. William. Thank you, Patel, sir.
Thank you all.
And thank you, all of you. Thanks for the last member who have joined recently, Dr. Mujibur Rahman. Thank you, all of you.